Hello and welcome to the JCN Clinic podcast show. I'm Jessica.
Carissa.
And we are joined once again by the fabulous Danielle from Bobbie Charles. Hi, Danielle.
Hi, ladies. It's so good to be here again. I can't wait for this conversation.
So for listeners who have heard Danielle on the podcast previously, we actually have started a skin series. So you can go back and listen to the first one, which was a couple of weeks ago, and I'll pop that in the show notes. Today, though, we're going to be talking all about rosacea, which I'm really excited about. It's such a big one for us at the clinic, and I'm really keen to learn more from Danielle from your perspective as far as treating rosacea. So, yeah, it's going to be a goodie.
Thanks, ladies.
So, we're going to definitely give our perspective from a clinical point of view as we go through. But to get us started, obviously, let's talk about rosacea itself. And if you could start, Danielle, and I'm really keen to hear you say these different types of rosacea out loud. And talk a little bit about rosacea itself. And obviously, there are 4 types of rosacea. And you get some sort of prize, I don't know what, for pronunciation if you can get these out. Some of them anyway.
I saw in my show notes, I broke it down.
You can, or you could turn them into acronyms, right?
Right. Well, first of all, I do want to give just a quick disclosure that I am dermal therapy qualified. So it kind of sits above a beauty therapist and in between, a lot lower, I'm going to say, a dermatologist. Dermatologists do many, many years of study. So I just want to respect them first and foremost, because as a dermal therapist or beauty therapist, it's actually outside of our scope to be able to diagnose. That said, we do a really, really good beauty therapist or dermatherapist really understands the foundation of rosacea, where it's come from, and how to treat it safely. So I was doing some research yesterday just to make sure my education on rosacea is really factual and research-based. So I will be reading from some keynotes because there is, as you said, some large words in here, and I want to make sure everyone gets the education they deserve. But yeah, so when I say I can't diagnose as a dermal therapist, I think when you put a blanket approach onto our industry, because we can't diagnose, a lot of people end up just not looking into it and they're too scared to talk about it or look into it further. But it's really, really important for a beauty therapist and dermal therapist to actually understand it because it's so prevalent. And we absolutely can treat it. We just can't diagnose. And so going back to your question of what rosacea is, it's a medical condition, and it is, it often shows up around like the mid-face area, so across the cheeks, the nose, and sometimes periocular. So, yeah, and as you said, it can be, there's 4 different stages of it, so similar to acne. And funny, what's the word? Confused for acne a lot of the time because it presents as presents as redness and pustula sometimes, which that can be really scary because if you get treated as an acne client and go in with acids and stuff, you're going to make it worse. So as you said, yes, there is 4 types. The first one is your erythema total ungiectactic. It's a really hard word, but essentially what it is, it's persistent redness and visible blood vessels. So that's the 2 characteristics of it. And that's what you would probably see a lot of in the clinic, in your clinic. And I see it a lot in mine. And it presents, it often goes hand in hand with like a warm sensation and itchiness. And there's keywords I'm saying to you guys throughout, because when I bring in my ingredients that I use beside it, it counteracts this, right? So you've got that warm, itchy sensation, you've got the blood vessels, and you've got that persistent redness. And then number 2 is your papular. And so as it sounds, you've got your red bumps and pus-filled pimples, and that's the one that resembles acne. So it can be confused. However, it doesn't have blackheads. And then your 3rd one is your phymatitis, and that's that thickened skin and irregular nodules, and it's commonly on the nose, and you see it in a lot of older men and older women. And that, and then we go into stage, the next one, which is categorized on number 4, is your ocular rosacea. It's less common, but you get that eye dryness, irritation, redness, and sometimes some swelling as well. But we frequently see the first two. So the persistent redness and blood vessels, and then some of your papular pustules type of thing. Because once it goes onto the ocular area, we don't treat that, and we also don't treat that thickened skin on the nose. It's definitely, sometimes it can be a surgical thing to treat that. So it's, again, out of our scope. But what we do as beauty and dermal therapists, we essentially create specialized treatment plans to go hand in hand with the medical side if they want to go down the S4 medication, so your prescription side. But we provide more supportive skincare to manage symptoms and improve skin condition. Whereas if they're going to a dermatologist or they're getting a prescription medication, it's not helping. It's a Band-Aid effect. However, I do really respect that sometimes it's out of our scope and they do need that, but they're still going to essentially need to build up that skin barrier and structure of the skin so they don't get flare-ups again and bounce backs. But so that's essentially what it looks like. One of the questions that you guys wanted to unpack is kind of, where does it come from? So are you okay if I go into that now?
Yeah, absolutely. Actually, can I just ask, with the 4 types, you're sort of talking about them, as you mentioned them, speaking to them as stages.
Yeah.
From what you see, though, do you see a progression from one to the other, like stages, or it's more
Absolutely.
of a presentation of like, you have that ocular rosacea and that's how you present, like, and or do you know what I mean? Like, or do you tend to see that it will progress through?
I've never seen, it's a great question. I've never seen ocular myself personally.
Yeah, I've never seen it.
Yes.
I've actually had it twice over the last 6 weeks, which is crazy.
Really?
Yeah. 2 different people with it, which totally out of the blue. But yeah, other than that, I've never really seen it. I get a lot of the first 2.
And it can get misdiagnosed for perioral or periocular dermatitis, depending on where it is on the face. Because dermatitis can look pretty similar as well, because they get the swelling and the dryness, the itchiness, the warmth. So it can be misdiagnosed quite a lot. But going back to what you said, Jess, is normally we'll see stage 1. It doesn't always work in stages, but you're never going to just wake up one day and have stage 3, which is your that really thickened skin on the nose. And so my job is, if I'm seeing early stages of rosacea, so not full facial redness, like when they get redness all over their body, some people are just sensitive. When I'm seeing it across the cheeks area under an AI analyzer, my job is to then go, hey, we need to really repair and strengthen the skin, because ultimately it's going to get worse. And so that's where I ask those questions. Does your mum and dad have rosacea? Red? Are they pustular? And often it'll be like, yes. And so my job is then to go, let's not let it get to that. So it's all about prevention rather than cure.
Okay, cool. Cool.
Yeah. And so going on to how does it kind of come about is, you've got your genetic predisposition for sure, but it's not always coming from the genetic side. However, if they do have it in their genetic side, then you're going to be of a higher risk. The reason why it's coming from that genetic side, which I think is interesting, is you've got that the components that involve the immune system gene, which is so cool, because we have epigenetic facials in our clinic that support both external and internal genetic factors. So it's a whole nother, science nerd.
Epigenetic facials. That's wild. I love it.
It's really quite cool. Like, science today is phenomenal. Like, we're working really, really on a cellular level in today's society, which is awesome. Because essentially what we're trying to do is we're trying to get really, really good cells to replicate better cells, and we're trying to get crappy cells out of the body as fast as we can so they don't get worse. And that's, where you're coming down to your antioxidants and your exosomes and your all of these fancy things that I'll discuss as well. And then you've got your the immune system activation. So you've got your vascular dysregulation and increased inflammatory response. And it's very linked then to gut immune inflammation, right?
Exactly.
And then you've got your overactivity produced inflammatory peptides that cause redness and swelling. And then you've got your environmental triggers. So your UV radiation, the common things like heat, spicy food, alcohol, and certain microbes, as you probably saw in my keynotes, like the Demodex mites. Which everyone thinks that rosacea is directly linked to Demodex mites, but it's not always. So it can be, those are the three things. So it's normally your genetic, your immune system side, and the environmental triggers.
What?
Yeah.
Question. What are Demodex mites?
Yeah, I love that you asked that, because I did make sure I researched it before I got on.
Someone was going to ask.
Definitely, yeah, because I'm like, as soon as I read it again, I was like, I needed to refresh my memory. So they are tiny microscopic mites that naturally live in human hair follicles and sebaceous oil glands, so primarily on the face, but almost everybody has them anyway. But people with rosacea, they worsen rosacea by stimulating an exaggerated immune response. So that's what causes that inflammation, the redness, and the skin irritation. So it's really like an overabundance of infestation of Demodex mites that's linked with it. So you have too many of them.
I want to see this under a freaking microscope, because I have this like nightmare picture of these little things.
Yuck. And that's why I guess a lot of people with redness, after they read this, they'll be like, heck, I'm going to scrub my face so hard.
I'm itching just talking about it.
There's like a little nip. But they also carry bacteria, and that's what I want to make sure I talk about. So they carry bacteria that contribute to its inflammatory cycle. So if we remember bacteria, if we remember your inflammation, your redness, your heat, all of these kind of things, when we're looking at what rosacea is, we need to understand that to then be able to treat it effectively. And then lastly, just a reminder that it's not the sole cause. So if you're hearing this and you've got redness, please do not go and think you can just wash these little guys away. It doesn't work like that.
No, that's a great run through, particularly as far as those, I guess that, I wish I would say that pathogenesis, that sort of underlying causes as such. I think what's definitely interesting from our point of view clinically is exactly as you said, there's like this huge genetic predisposition, and then we've got these layers of like immune dysfunction and vascular dysfunction, and all of these elements that you're speaking to. And that heat for us is definitely looking at the histamine element, but what we often see clinically is that there are irregularities within that immune system that are often caused by gut. A lot of the time there can be other factors that basically enable that genetic predisposition to express itself. So often for us, again, clinically, when we deal with, okay, well, what is causing the inflammation, or what is causing that immune irregulation, or why is there this histamine flare occurring? And it's often a mix of all of those things. We'll see that rosacea calm or completely cease, which is, personally, I love treating rosacea in clinic because I feel like we get such great results. And it just is such a beautiful, maybe weird to use the word beautiful, but to me, it's such a beautiful skin condition as far as like showing the connection between like internal to external. So it just always fascinates me with all of those areas that you're speaking to, of course, which is what we always do, look at that internal activation versus all of these additional elements, as you said in your notes that you sent through our sandwich. As far as like how I'm really keen to hear how you come at that, as far as like the skin and the skin barrier and the bacteria element. So it's a fascinating condition. It really is.
I just want to add one more part to it, because obviously, Jess, you mentioned like Danielle, you mentioned as well, but that immune activation, histamine, all that stuff. There is a massive hormonal element to rosacea for some people as well. True. And that is something, obviously, me being a little hormone nerd over here. But again, when there's those gut and immune issues, quite commonly if there's estrogen or estrogen issues as well. Like when you kind of go through the internal layer of everything we work on, quite commonly if I'm working with histamine and estrogen for someone, like, and you know, yeah, I've seen that do amazing things as well. So it's always just something to consider if there's any other practitioners and they're really just working at that gut level with their clients and they're like, well, I'm doing the histamine work. They're seeing a beautiful dermal therapist. And, you know, if they are a estrogenic female, like that is another element to definitely consider, because obviously there's that huge relationship there between, you know, the hormones and histamine and the gut and immune activation. So yeah, I wanted to add that.
We're such nerds. You mentioned something about like barrier impairment, and when I normally treat rosacea, that's what I'm generally treating it as, barrier impairment. But there is, if there's any dermal and beauty therapists listening, there is such a missing link between when you're treating barrier impairment. Normally you'd just be treating, if you've got Lutronic or any other LED, normally you're just treating it with like your yellow wavelength, which is more for redness, inflammation, which is great. But I don't know if you guys saw it in my show notes, but there's actually a really good link between your 415 nanometer, your blue LED, which normally supports acne, which is killing off that bad bacteria, and Demodox. Yeah, right. The link between it. So if you have a rosacea client, often they'll be like, oh, I'm too scared to put them under 415, whereas you're doing a client a disservice. But rosacea is definitely linked to impaired skin barrier function, but it is quite different in the way that you've got that increased immune overactivity. So someone with just impaired skin, they might have impaired skin, and it's normally from external factors. So environmental things, or they've put too many acids on their skin, or they've just done too much from an external space, whereas rosacea is very much your internal base as well. But rosacea definitely still gets your transepidermal water loss, which is it's a true dehydration. So the barrier is not actually holding everything in and stopping everything from outside coming in. So we need that protection, but we also need that occlusive, like to have the skin work in a way that it protects. That's what it's like, you know, essentially meant to do. But just to close this off, is, I don't know if you saw my notes, but it's got something that I don't understand anything about, and I wanted to ask if you guys actually are aware or can educate me on this. But it says rosacea, the barrier impairment is compounded by abnormal activation of the innate immune system, particularly involving overexpression of toll-like receptor 2, so TLR2. Have you guys ever heard of that?
It's basically talking about that aberrant immune function. Like toll-like receptors are, how do I explain toll-like receptors? Like they're immune based receptors that some of them will either, I hope I'm not bastardizing this, but some of them will have a switch on effect on the immune system. So they're immune regulatory. So they can be irregulatory or regulatory.
Right. So they're the ones that say they're the bosses in there.
Yeah. And like it kind of from the perspective of almost like thinking about autoimmunity, you know, as far as like how the immune system can be overexpressed versus being more like modulating. So I think as far as overexpression of toll-like 2 receptor, I'm pretty sure that toll-like 2 is more of like a overexpression of the immune system. I hope I have that right.
It's right. I just threw
it's like when you're like, we have also with the inflammatory picture, we have what we call interleukins, and there's like interleukin like 2 and 10 and all of these different ones that we know are involved in different sorts of inflammatory conditions. But like, to remember which ones are what sometimes is a little hazy.
Yeah, you're such a wealth of knowledge, babe, honestly. The other thing that I found fascinating when I was doing the research is rosacea, it also got an elevated skin pH. So if you go and put acids rather than alkaline on the other side, if you go and put acids on them, it's just, you're going to get so mad. So everything is about like homeostasis, right? Getting that equilibrium back in the skin, which again comes back to skin barrier and healthy microbiome and just getting the skin acting the way it should. So everything comes down to calming, cooling, hydrating products. But the one thing that makes rosacea stand out is your vasodilation. So people that have got your sensitive skin, you don't normally have that as sensitive and barrier impairment. You don't normally see a lot of the vascular side of things. So again, when we understand there's vascular and there's warmth and it's barrier impairment, you've got to be having ingredients that actually tailor to the vascular side, you know, and ingredients that tailor to the cooling and the calming and, you know, all of that jazz.
That makes sense. It's quite complex. Like really I feel like when we've obviously with regard to speaking of acne previously, like of course it's got its own complexities, but I feel like rosacea, just again from what you're speaking to from a dermal therapy point of view, like it's multifactorial, like from a barrier function perspective, and you're talking about that hydration. Yeah, had no idea from that perspective. But yeah, then you're thinking about all of that heat that is in the skin. And for us, like that's where we think about that heat as far as that vasodilation and a lot of that, histamine activation and aiming to like calm that as well. But that's where, they're just so beautiful in how they marry together. So I guess as far as treatment goes, obviously be good. We'll share a little bit of how we would approach rosacea, but you've already alluded to some of that and what you've been speaking to, but is there some other factors just to share with the listeners as far as that treatment and like options that they have? I know there's also in your notes, you're talking about some of those medical treatments as well. So there's a bit of a barrage, but I'll try and keep would love to hear your thoughts.
I'll try and keep it light just for time. But your medical treatment options, which is your prescription side, you've got a lot of topical antibiotics like metronidazole cream or gel, so it's a topical one. This one doesn't cause photosensitivity, which is great because as a dermal and beauty therapist, I'm always looking for that. Like we want to be able to give them light therapy, right? So if they go to a dermatologist and get, say, sometimes they'll prescribe oral antibiotics like doxycycline, minocycline, and isotretinoin and Euroaccutane, we can't treat them for months, 3 to 6 months. So you're on your own, and essentially it's a Band-Aid effect. So if they get your topical prescriptions, as mentioned, none of them have your photosensitivities. But one I do want to talk about is your azelaic acid.
Azelaic, yeah.
Anyway, that one. That works it's a natural acid that they prescribe, and it works on an anti-inflammatory and antibacterial side. So it's got your anti-inflammatory sides, antibacterial, antioxidant, but it's also got your gentle exfoliation in there as well. So when I'm going, okay, what can I give this client that is completely safe, botanically derived, not medical? I've got so many things in my toolkit that I'll talk about that we prescribe them that hits every single one of those marks, but it's also helping to build up their skin barrier, hidden anti-aging benefit as well. So it's long-term consistent results rather than a Band-Aid effect. So if it's not going away from my approach or our, from Bobbie Charles' approach, absolutely, you should go and we'll refer. You might need to get some medical support just to get it more at bay, but we've never had to do that ever. We've had some great circumstances where clients have come in and they're just really affected emotionally because they can't drink, can't sit in the sun, by the pool with their friends because they flare up for a week afterwards. So, and then so that's more of the medical side, but going into more of the stuff that we do is we would prescribe a pharmaceutical grade product. We generally tend to lean towards is clinical, just because of the science based and, how high functioning it is. And then we go into our light-based therapies. So we use Lutronic in there, using those two modalities, as I mentioned. And then the two different wavelengths, as I mentioned. And then we also use microneedling for rosacea as well. However, you should never be using it if you've got a flare up.
Right.
If your skin's really healthy, everything's okay, that's when we would go in and use a microneedling device to actually, build more collagen, to actually strengthen the skin. So you can't see so much of that vaso side, and then we would also bring in retinols at that stage as well, but only in the is clinical range, purely because they are built in a way that it's an emulsion. It's built with all of these other beautiful ingredients that help to cool, calm, or it does have your exosomes and all these other fancy things in there that we don't have time to discuss today. But honestly, like when you put that next to a really good grade skincare, you've got results for life, not just a Band-Aid effect.
That's fascinating about the microneedling, which makes sense with how you explain that. But I guess even, as you said, you could go into huge detail about all of these different therapies. But I think even for listeners just hearing that there's so many options through dermal therapy, because I actually think that I'm thinking of a client I spoke with this week, like with just even respect to LED, like a lot of the average people don't realize what options are out there through dermal therapy. So I know even me hearing everything that you've talked about, I'm like, holy moly, there's like a barrage of additional options here I hadn't even considered. And again, if we're like layering these on top of like working through that internal drivers, then it's just magic.
Yeah, absolutely. And as I said, it's not to say that you don't, we do really still respect that dermatology side, right? You have to, the medical side. But if it's at your early stages and, we want to be treating it for long-term effects. And because all of those other medical things, they come with side effects, right?
Yeah.
All of them. Yeah. Every single one of them. So
I just think...
I
just think too, like just working with rosacea so much, like you don't want it. Like I understand, and same as you, Danielle. Like we've got so much respect for the medical field in this space and clients getting the proper diagnosis first, like so that then we can come in and do our work. But you don't want to be in a lot of those especially the photosensitive medications, probiotics. My goodness. Antibiotics, am I saying that right? God, my brain.
Yeah,
anyway, all that stuff.
Yeah.
Thank you. I was getting confused with our space, and I'm like, come on, brain. You don't want to be on any of that stuff long term, and that's the thing with. And again, full respect to the dermatologist field, but if like Roaccutane for acne is not a lifelong solution for it, just in the same that these my goodness, speak, Carissa.
Photosensitizing.
Thank you guys. I'm just coming out of this influenza and I'm trying really hard.
You're doing good.
Trying so hard, guys. That again, you don't want to be on this stuff long term. You don't want to be on antibiotics long term because obviously it's no secret that there's going to be microbiome disadvantages to doing any of that long term. But then even from your point of view, anything that is changing the actual lipid layers and the degree to which anything exposes the skin to its environment long term is going to have other damage, other issues. And I know even just clients of mine, which is not a typical treatment for rosacea, but I've had clients where they haven't even been diagnosed with their rosacea properly. They've been diagnosed by a doctor with perioral dermatitis and it was rosacea and given a corticosteroid cream and taken something like that, applied that long term. Like I can only imagine what you think about that, but I think about what that does to skin barrier when you've just got something literally just peeling layers off to try and control a skin concern, and then it's so disheartening. And that's what I mean, like full respect to this space and what it has to offer. But if we can get someone to correct diagnose, last resort, or even just as a management tool for something really acute and inflammatory, while then we come in and do our work respectfully and get that medication out of there and apply everything you've just said from a topical and light point of view and everything we can do from an internal point of view. And the outcome for that patient is long-term health and very minimal, if not no ongoing skin stuff. you know, and that's where I think, you know, there's so many people stuck in that, you know, the medical model of treating rosacea where they're on something long term and that just is their pathway option, because they don't actually know that there's this whole other area where we can all come in. Sandwich the living shit out of them, but no, you know, like sandwich them and you do your work and what your team do, Danielle, so well. And I've actually just learned so much as well, like that there's actually even so much more that can happen there. But yeah, like it's crazy. But so I think for anyone that's stuck in the medical space with this going, this is my life moving forward, I can never sit in the sun and have a cocktail. I beg to differ.
Yeah,
okay, I'm putting
so true. It's in the sun of it.
Definitely.
Yeah, I agree. I think with what you're saying there, Rissy, too, of course, yeah, these medical options are there, but rosacea is a condition that we see a lot clinically on both sides here, and it's just that there can be so much done before having to like jump to always going to the need for like that medical approach. So I guess actually to speak to that further from our side of the fence as far as treatment goes, and I know I mentioned this a little earlier, for us when we have someone come to us with rosacea, we're looking at, as I was saying, like what can we do to control that inflammation, but also where is that inflammation coming from? Where is that histamine element coming from? As far as the immune system, and how can we help modulate? Often we'll speak to more of a modulation of that immune system, because we're not wanting to like turn it off, but we're wanting to, in most cases with a condition like rosacea, settle it down, basically calm its farm, I'll say to clients. So often that will involve looking at their diet, and people with rosacea will definitely often tell you they have foods that will classically make it worse, as far as like classic spicy foods and alcohol and certain spices, and sort of the list of those things goes on, but that's sort of the classic ones that come to mind at the moment. But then also we will often see that there can be a layer of potential food intolerances, and whether that is something can be alleviated as we improve their gut health. I know for my clients with rosacea, there's often actually a really strong food intolerance component. And I often see dairy being a big problem with rosacea. I've actually seen rosacea heavily improve just by eliminating dairy out of some clients' diets. I'm not saying that's all that it is, but it's worth mentioning. And also their histamine load in their diet. So they a person that needs to consider a lower histamine diet whilst we're working out what's going on? It's not always the case for all clients, but it definitely is worth mentioning because it is utilized. But generally, a lot of the time we're looking at the gut and looking at functional testing to see what is going on there as far as the microbes in the gut and with how that immune response is behaving in the gut, whether that's through certain gut health markers, but also the microbes that are involved with that. There's a lot of information there that we can use to treat, but we may also, as Carissa said, be looking at their hormones, depending on that hormone element. And there are other sort of tests that we could consider as well, as far as looking at their overall immune function. It's actually so complex. Like, I'm sure, like as I'm speaking to it, I'm like, oh, we do this and we do this, but essentially I like to think as rosacea as something we're going in and we're looking and digging for the why, like what is that core driver? And 9 times out of 10, there will be a gut component at the core, but there may be other arms coming off that as far as potentially, the hormones or how strong that histamine element is, which, to be honest, is often linked back to the gut anyway. So the cool thing about it is that once we start actually treating why that immune system is in disarray and calming the histamine response, I feel like it's pretty quick as far as seeing like the intensity of, say, either the redness or the pustules reducing. But it does, as we've spoken before, it does require work. It's not an overnight fix. Like, you're definitely working overtime to settle down the inflammation, but then also to, in some ways, from a gut perspective, definitely create a more robust environment overall, and really allowing the time for that to develop so that someone is able to then go back to diversifying their diet and sitting in the sun and having that cocktail, as Carissa said. But I do find with clients that those genetics will always be there, to go right back to what we were saying at the start. So clients that I've worked with that have been in such a state of to the point of not wanting to go out into public because their rosacea is that bad, to feeling like it's completely resolved and being able to eat whatever they want to a point with their food intolerances, they will still have a tendency a year and a half, 2 years later to flare if they, say, hit the booze too hard, or they just start having like a lot of the food that is their say intolerant food, or as food sensitivity food. So there's always that genetic predisposition. But if you can deal with all of the things that I was just speaking to, then often the regression of the condition and the control of the condition is so profound. And that's what I find, again, so exciting about it. I don't know if I missed anything that's like a massive red flag in that, Rusi, that you wanted to speak to.
Awesome.
Oh, good.
I know that you guys are short on time, so should we give people some actually where to now? If I've got rosacea concerns, what do I do? How do I book with these girls? What products can I be on to kind of start my journey?
Absolutely.
Ledge. So if you guys are listening and you've got those concerns, you can absolutely book in a consultation and treatment program if you're serious about results. We've got the Lightwich in the West End location. If you use our JCN 20 discount code, you will get promo code. You'll get your discount on your first treatment with us as well. So you can book your consultation. That's where we'll create your full program and start your journey. However, if you aren't in Brisbane and you would like to still treat it at home, I would like to give a quick and easy skincare program that you can be on. And so as your dual cleanse, so we like to use two cleansers because they're both doing two different things. One's your cream cleanse in Is Clinical. This whole range is Clinical. So Is Clinical cream cleanse. Your cream cleanse has shea butter for that moisturization and nourishment. It's got glycerin, which retains moisture. It's got your sweet almond oil that works to cleanse without stripping your skin. Your chamomile extract, that's anti-inflammatory, and your calendula extract, which soothes irritated skin and promotes healing. So as we spoke about, all of those things that rosacea has, it's got all of those beautiful benefits. And then you've got your honey cleanse. It's a warming honey sensation. It's my favorite one. It's got your antibacterial and anti-inflammatory properties in it. So you would use that as your cleansers. And then you would go into a treatment side. So you've got your Pro Heal serum and you mix it with your Hydrocool. Just for time's purposes, I won't go into each ingredient, but maybe we can link them in the show notes. Is that a thing?
Yeah, for sure.
Yeah, if people want to nerd out, but every single one of these products help to strengthen the skin. You've got your antimicrobial side, your antibiotic side, all of the things that rosacea has, this actually treats. It's even got cooling and calming ingredients in these as well. So you've got your Pro Heal serum and then your Hydrocool serum that you'd mix together morning, and then you would hydrate. So I will say the Daily Dynamic Hydrator has just dropped in Australia. I don't get any endorsements for this, by the way, but it's absolutely phenomenal. I cannot wait to use it on my skin. I was just doing the study of it on Tuesday, and the science behind it and what it actually does is perfect for rosacea. So no one in Australia has got, actually it just came in yesterday. I was going to say no one's got it yet. So it's just come in yesterday across the whole of Australia. Cool. So that's your Daily Dynamic Hydrator, and you would use it morning and night. And then you've got your repair side. So you've got your retinol emulsion. It's the only retinol that I would recommend, as I mentioned to you, that's safe for rosacea, and still I would use it very sparingly. So that's one that if you're really flared up, absolutely no. But if you've got it under control, you can start using that retinol just to build up the integrity of the skin so you don't consistently get flare-ups. And then most importantly, guys, please, please, please protect with a really good SPF. I recommend using the one in Is Clinical again. just because it's got all your extreme enzymes and all of this sort of stuff, that it's not just protecting you, it's also repairing you at the same time. It's got a beautiful ingredient list, which I will give to you guys and you can pop in the show notes anyway.
Just too, for all of our listeners, like, because obviously we've got like such an Australia-wide reach, like just obviously all these products are available on the Bobbie Charles website, but you guys, for anyone listening that's not in Brisbane, there are skin consults available. Like if you're like, oh, I'm terrified of using products, or I've never used a retinol or anything like that, because I know people straight away, like I'm just, as soon as you said that, I can think of a handful of clients that would just have so many questions around that, especially if they have rosacea or they've got acne or anything going on. Like you can book a consult with Danielle and her team and just have that chat about what is appropriate for your skin from a topical point of view. So you're not going to a chemist, buying just random over-the-counter products. I think it's really important here too. Like, again, I'm not a skin expert, but I know it's so much about even just the type of cleanser you use for the type of skin that you have matters immensely. And, you know, again, like that can come from you, Danielle, but even coming from me as someone who knows very little about skin products, but I just know that, like, if you've got like this, you know, rosacea and this skin barrier impairment and you're using an oil stripping cleanser thinking you're doing the right thing, like this is where, you know, just even having that, you know, skin consult to discuss the right type of products for your skin will be so valuable. Like, so this, you know, like, yes, these products are available online, buy them if you're confident in loving them, but also have a chat to the girls and see if you're using the right things and, you know, what else is appropriate here. So
yeah, please. Thank you so much, Carissa. Yeah, absolutely. You can have a free conversation with us at any point. You can book a 15-minute chat for free. You can do that 100 times if you like. I would never be mad. Honestly, I will never be mad. Like, we're here.
You can do that 100 times if you like.
We do that purely to educate you. Like, if we can have women walking around feeling empowered and like just absolutely on fire, that's our job well done. Like, we're not, it's not about profit first for us. It's truly about like, let's get this, everybody shining as bright as they can. That sounds so fluffy, but truly.
Oh, that's great. That is a good note to finish on. I'm sure listeners have had, I know it's been a quicker episode today, but I'm sure listeners have gotten a lot. And obviously our listeners definitely are often coming from more of like a nutrition interest space. But I think this has been really, as always, valuable to show what we can do from our side. But absolutely, when we create that magic sandwich and add that component that you bring from Danielle and Bobbie Charles brings, and just again, Carissa and I always learn so much, and it makes me excited for our clients because likewise we just want them to feel better as soon as they can, and often this is something that we're asked, like clients are asking us, you know, okay, you want me to do X, Y, and Z, but what would you say I put on my skin? What could I do there? And it's just like, well, here you go.
I wish we could actually create a shopping cart. I wonder if we can create a shopping cart, like a wish list that you can just send to everybody and it's their 5-step. And it's just like there.
Yeah.
Just check out.
Yeah. Yeah, we could. For sure.
For people, you know. But yeah, we'll put the links and stuff in the show notes to all of those products and all that.
Absolutely.
I learned so much again today, guys. Sorry if it was a little quick for everyone listening. We were pumped for time, so I learned so much.
All good. Well, no, thank you so much again. And we will be doing another session for our skin series on pigmentation to come, which I'm really excited again to learn a lot about. But yeah, thank you so much for your time. It's just been great. And thank you to everyone for listening. We 100% appreciate it. If you share this episode, if you found it valuable on your socials, that would be amazing. But otherwise, have a magic day or evening, and we'll chat to you again soon. Bye.
Bye. See you.